Good morning. Today is Tuesday, February 13th, and it's Politics with Pierre. So today I want to talk about a local issue that is very concerning to me. So state officials are proposing to close down SUNY Downstate Medical Center, which is a huge deal. So for those of you who don't know, SUNY Downstate Medical Center is located on Clarkson Avenue, and it serves communities in Prospect Lefferts Gardens, Wingate, Flatbush, Crown Heights, and the larger central Brooklyn community. So SUNY Downstate Medical Center is a part of the larger SUNY Downstate Health and Sciences University, which is a major research university and medical school. But the hospital is what serves patients. So who do they serve? They serve patients that are on Medicare, Medicaid, patients that are underinsured, without insurance, and they serve a lot of patients that are low income and patients that are in communities of color. So this hospital is extremely important, and for those of you who don't know, they serve 3 million people. 3 million people. So some would say, hey, what's the big deal about closing the hospital? Kings County is right across the street. They serve 3 million people. And I say this, we just came out of a pandemic. We've seen the effects of a global pandemic. Is this really the time to now close hospitals? What happens to the state commitment towards health and safety? So let's talk about, how did SUNY Downstate get to this point? Why are they talking about closing this hospital? Well, it's being reported that they have a $100 million deficit, as it was reported by the New York Times. And it also is reported that they have a deteriorating building, right? So what caused this, right? So this is years of neglect and underfunded by our state government. SUNY Downstate Medical Center is a state-run hospital, and it has been neglected. And now the state officials have said, hey, let's throw our hands up, let's close down the hospital, but we want to keep the medical school open so that we could keep getting money from the medical school students. So what are the negatives to closing this hospital beyond the ones that are already obvious? So during the pandemic, we've seen that there was a huge shortage in beds. There weren't enough beds to service all the people who are getting sick. People are still getting COVID, and people are still getting sick from respiratory diseases. We're closing down an institution that has over 300 beds and serves 3 million people. The plan is to move patients to the hospital across the street, Kings County, which will possibly create overcrowding, right? So on top of that, you have patients who are on Medicaid, Medicare, who are already used to SUNY Downstate. We're talking about people who don't normally seek healthcare and don't normally have access to healthcare. And now they're not going to have the providers that they're used to, and they're not going to have the hospital that they're used to. So this is a huge issue. Also, at a time of rising housing costs, the rising cost of goods, we're putting people out of work. And that's why the unions are not in favor of it. Unions like the United University Professions, unions like the Public Employees Federation, they're not in favor of this because just from one union, which is the UUP, they could lose about 10 to 20% of their staff. These are people who will be out of work. Brooklyn is facing healthcare inequities, and there's a huge Black maternal health crisis. So I pose you this question: is it a good idea to close SUNY Downstate Medical Center? There have been some talk about reimagining it, reinventing it, transforming it, shrinking it, some talk of creating housing, some talk of creating instructional institutions. But so far from what I see, it does not look like it's a good idea to close down this hospital. But I want to ask you this question. Please leave your comments. Please ask questions.